Hello everyone, welcome to our channel Health for You by UB Media. This is Dr. Vaidyat Pathak, dental surgeon and implantologist, founder CEO of Tea Time Dental Clinic, and a visiting consultant at various clinics and dental hospitals in Indore. This video is to really help you understand what a dental implant treatment is. Now, in a nutshell, a dental implant treatment is just one of the ways to replace a naturally missing tooth. The other two ways are removable dentures and a bridge. Of above three mentioned procedures, both have advantages and disadvantages depending upon the individual circumstances of the patient. Dental implant is the closest way we can get to a replacement of a natural tooth. Once the dental implant is placed in the bone, integrated, it is fixed, it is much stronger than the natural tooth and it looks pretty realistic as well. A dental implant, it is a pretty long lasting treatment and its longevity depends upon your oral health, medical conditions and other predisposing factors as well. Before getting a dental implant, you are required to do some blood test and a good CT scan of the jaw, which will help to determine the quality of the bone, which would further help us to understand the size of the implant in other procedures which would be required like sinus lift or bone graft as well. At simpler level, let us understand and divide dental implants into three different parts according to the process and the procedures which would happen. First one is the dental implant itself, which looks like a screw which is made up of titanium and typically which is screwed inside your bone. As patients, you will never ever be able to see a dental implant in your mouth. The second part, which is the abutment part, which is essentially a little connection between the implant part and the crown part, which would be further attached into your bone. The third part is the crown part, which resembles to the natural tooth structure and establishes functions and aesthetics in your jaw. As patients, you really never want to see a screw in your mouth. You basically want the teeth or a crown which replaces or rehabilitates your function in your mouth. Second part is the abutment, which is essentially the little connection which connects the tooth part of the crown to the implant which is inside the bone. And the third part is the crown, which resembles a natural tooth structure and establishes functions and aesthetics for the same. To make it simpler and to address it to the larger audience, I will be talking majorly about a single simple conventional dental implant. Now let us understand the procedure in brief. After the incision is done, the flap is reflected on both the sides and the holes are made by the drills depending upon the implant size. Then after the holes are made and the site is prepared, the dental implant is placed inside the bone with the help of a ratchet. Like this, implant is placed, which is inside the bone and which you will never be able to see. And then a cover screw is placed over this and the flap or the gums are sutured back. Then the healing time of 3 to 4 months, and depending upon the location of the implant, the site and the procedure done, the healing times varies patient to patient. Then after the suture is placed, then after 3 months the site is opened and then the prosthetic work is done. This was it for today. Thank you for your precious time. For more such informative videos, please like, share and subscribe and hit the bell icon.